they're starting to look at kidney transplants much more in animals. Now that's important for not only animals, but also for people, because they're finding more things that they can do to make it more successful. For instance, here's a perfect thing that people probably don't even know. They're doing a lot of some specialty universities. Of course, these are specialties. They're doing transplants in cats, you know, in the feline area. They find out that if you do a kidney transplant in a cat, the success rate exceeds any other animal, for instance a dog, and even humans. In other words, if you remove the tumor or you couldn't remove the tumor and chemo was used or not used, but let's say nuclear medicine is used, we're using a emitter, which shoots gamma rays into that area. But unfortunately, one of the biggest problems with that type of, not only the therapy, is that it affects, even though you try to pinpoint as much as possible, it affects other areas of the body. And you have, of course, you're going to get radiation burns, you're going to get a lot of side effects, because radiation, we're not supposed to be hit by radiation. You know, it's unstable molecules hitting us and causing our cells to mutate and do things that we don't want them to do. But there's another form of breast cancer surgery called IRT, which actually you have surgery and you pinpoint the beam directly in the open area. In other words, it's not hitting the whole body, it's hitting just the area where the tumor was removed. When the surgeon has it open and then it's closed up and that's it. And so that actually is much better if it can be done, in my opinion, and this is a new type of therapy. And because it doesn't affect the rest of the body, and the side effects won't, if you have any, won't be very much lowered compared to what the side effects of a 6-week, 5 days a week radiation therapy would be. Articles that have anything to do with kidney disease or nutrition for the kidneys or diet or menus and things like that that people need to know, those will also come up individually, in other words, on the blog. And that's what we're really developing right now. We're starting to get all of this subject matter to where people, for instance, this month, a perfect example is breast cancer. Month is October. We have a lot of articles on breast cancer. But if you go to last year's October issue, there's a lot of articles of breast cancer also, but your question is good because now where do I find information on breast cancer alone? And so that's where you can actually put in breast cancer issues or anything breast cancer. And once that goes in, and there's a search box. Every article that's been written so far in Nutricula Magazine will come up. And then, of course, we're evolving. We're going to be having a lot of videos